Hi, everybody. Thank you for joining today's webinar. My name is Jenny Wilkins, and today we're going to go through a sample analysis focusing on the Harmonized CHARLS from the Gateway to Global Aging data. We would like this webinar to be interactive, so if you have any questions or comments during the webinar, please feel free to use the question box or the chat box. There's also a handout provided for you, which is called Advanced CHARLS Webinar June 2020.doc. You can download that in the Handouts section of the GoToWebinar panel. That's actually a Stata-Do file, so you can download it and remove the C from the extension and run it in Stata. So now we're going to go ahead and get started. Sorry about that. So we're going to first do an analysis using the Harmonized CHARLS. Then we'll be comparing the results to the United States using the Harmonized HRS and RAND HRS. You may be wondering why I'm mentioning two data sets for the HRS. The RAND HRS is the original and main user-friendly dataset for the HRS produced by the RAND Corporation. The Harmonized HRS is a supplementary dataset created by us at the Gateway that includes variables the RAND HRS doesn't already have and that maximizes comparability with our harmonized datasets for other studies. But don't worry, they're easy to work with together. We're going to pick a research question to start with and get a feel for using the Harmonized CHARLS. Today, we're going to be asking, are there differences in total word recall across gender and self-reported hearing level? CHARLS, along with many other HRS sister studies, reads the respondent a list of 10 words and asks them to recall the words immediately and again after several other questions have been asked. A total word recall score can be created as the number of correct words remembered immediately and delayed with a total possible score of 20. We'll be looking at mean total word recall score and creating a self-rated hearing variable using original CHARLS data. Then we'll be looking at the mean total word recall scores across gender and self-reported hearing levels and perform an adjusted walled test to compare those means. So the steps we're going to go through first are we're going to download or create the Harmonized CHARLS dataset. And we're going to identify the relevant variables. We're also going to create a self-rated hearing variable. And then we're going to apply weights and start looking at the mean total word recall in China by itself and across gender and self-reported hearing levels. So the first thing we're going to need to do is download the Harmonized CHARLS from CHARLS on the Peking University website. If you'd like a direct link to the website, I suggest you visit the Gateway to Global Aging data, which can be reached at g2aging.org. That's the website that we maintain. It's a centralized resource for researchers looking to use these harmonized studies. Before you can download the data or harmonized dataset, you'll need to register for CHARLS and for each HRS sister study you're interested in. Let me take you to our downloads page. To register, you can go individually to each website in the top row using the links, or you can use our universal access to study data. You can select which studies you're interested in registering for and get most of your registrations done at once. Once we've downloaded the Harmonized CHARLS dataset, we can download the Harmonized CHARLS codebook from the third row of the downloads page. Next, we want to identify our variables of interest. And since we'll be comparing it to the HRS later on, we want to make sure that they're comparable. It can be difficult to find different measures that are comparable. So you could download the study questionnaires and look through them, But we've also built in a search function to the Gateway to Global Aging Data and a couple other helpful features for finding these comparable measures. So if we jump back to the Gateway website and select the Surveys at a Glance on the top left, you'll see our survey page. So we could navigate through this table to look at the questionnaires by clicking on Charles Wave 4, which gives us the modules within the questionnaire, and then select Health Status and Functioning, and start looking through the flow chart or through the list of questions. But this isn't the easiest thing to do when you're just getting started. Instead, we can search by keyword and type in our keyword. So for example, I'll type in hearing. We can even select the studies that we're interested in. So I'll select the RAND and Harmonized HRS, Harmonized CHARLS, HRS, and CHARLS. And I'll go ahead and click search. So by doing this, we'll get information on variables from all sources, including the original studies or from the harmonized studies, all related to that keyword of hearing. You could also do a search of the harmonized studies by subtopic. Here I'll scroll down to the cognition section and select word recall. I'll keep the same sources I had before, but I'll limit it to the year 2014. Then we'll see all the harmonized variables for these two studies. Searching by subtopic will only produce harmonized variables, whereas searching by keyword will produce harmonized variables or original survey questions. But when we look at these harmonized variables, you'll see the naming convention is pretty simple. So the first letter is always an R, an S, or an H, meaning the respondent, the spouse, or the household. The following number represents the wave number. So for the Charles, these are wave 4 variables. And then this is followed by a short term that represents the concept captured in the variable, like IMRC for immediate word recall. You can click on any of these to find out more information. Another way to find comparable variables is to look at our concordance tables under the Concordance tab. You'll see that we have many different domains with tables showing comparability between different studies. So we're going to be looking at the cognition table. We'll look at immediate and delayed word recall. We see that HRS uses a 10-word list for their ahead cohorts and again starting in wave 4, while they use a 20-word list in their very early waves. Charles uses a 10-word list in all of their available waves. So this can be a helpful place to get started. You can also get a more in-depth comparison by checking out our working series. And then we have the harmonized code books, which provide a lot of information. So once again, you'll go to the Download tab on the Gateway to Global Aging Data, and on the third row, you can download the Harmonized Codebook. We offer codebooks for all of our harmonized data sets. I'll go ahead and pull our Harmonized CHARLS Codebook. As you can see, it's as of April 2018. You can use the bookmarks on the left. For example, I'll scroll down to section D and select Total Recall Summary Score. As you see, we have the name for each variable and some brief descriptive statistics. You can learn more about how the variable is created in the How Constructed section. And we also highlight any difference between waves or between the Harmonized and the RAND HRS or Harmonized HRS versions of the measure. We always use the HRS as the basis of comparison when creating the harmonized data sets. So if we go back to our research question, we're going to look at total word recall across gender and hearing levels. So we'll need to identify our selected variables from the Harmonized CHARLS, and you can do this using the resources available from the Gateway website, g2aging.org. While CHARLS and the HRS are longitudinal studies where they go back and interview people on an ongoing basis, we're going to be doing a cross-sectional analysis, meaning looking only at 1 year or so for our year of interest, we're going to look at 2015, which happens to be the fourth wave of CHARLS, to do a cross-sectional study and sort of a snapshot of total word recall. We at the Gateway call it the fourth wave of CHARLS and refer to the life history interview as wave 3. But I want to let you know that this core interview is also sometimes referred to as wave 3 in CHARLS documentation. For CHARLS, the person identifier is called ID, and the total word recall score is R4TR20. The respondent's gender is RA gender. We'll also pull in the respondent's age in 2015, called R4HY, and their harmonized education level, which is a simplified version of the ISCED categories called RAED-UCL. And we have our individual analysis weight in R4WT RES. CHARLS doesn't include every variable available from the survey, including hearing right now. But we can easily add this variable by using the original CHARLS variable DA039. So we're going to go ahead and start using Stata now. And remember that in the handouts we have that .doc file, which is really a Stata do file that we're going to open up. So we'll open that up in the do file editor inside of Stata. That's this little thing that looks like a notepad and a pencil. If you're unfamiliar with Stata, I'd encourage you to follow along. A lot of the commands will be similar if you're using a different statistical package like SAS, SPSS, or R. We do have some samples of a similar analysis in SAS that we provide, which I'll show you how to find at the end of the webinar. So I'm going to go ahead and open up this program, which is called Advanced CHARLS Webinar June 2020.do. And if you're following along, you'll need to edit lines 5 through 9 to say what folders your data is coming from. One other thing you'll notice in the program is a command called pause. So once we start the program, the pause command will stop it at different points so we can look at the output that Stata has given us, then continue to move on. So we can execute or run this do file by clicking on this icon with the arrow on the top right. If we go back to our other screen, we can see that Stata has run the do file to our first pause, and when we're ready to continue, all we need to do is type Q and enter, and the program will continue running. So I'll go ahead and bring up the commands on the slides where it's a little easier to see. Then we'll jump back and look at the output. So the first thing we want to do is read in the observations and variables from the Harmonized CHARLS. We employ the command use because we're going to use this data set and bring it into Stata. Stata works by building a dataset in its memory, which makes it fast, but it needs to be brought into Stata memory first. So we're going to use the variables we identified using the Harmonized CHARLS dataset. You'll also notice that ID is capitalized while the other variables are not, and that's because Stata is case sensitive and the ID variable needs to be capitalized. Then we're going to perform a one-to-one merge using the ID variable, meaning we expect there to be one observation per respondent in each dataset, and we're using the health status and functioning dataset downloaded from CHARLS. Then, because we don't need to use the entire dataset, we're going to specify that we're going to keep using only the variable we need, so DA039. So if we jump back into Stata and type Q and enter, you can see that we brought in the variables from the Harmonized CHARLS and perform the merge with original CHARLS data. When this merge happens, Stata creates a variable called _merge to indicate how our observations matched up. And we can see that about 21,000 matched and about 4,500 didn't match. And that's because the Harmonized CHARLS contains all waves, and this data set only contains data from wave 4. And some people previously interviewed were not in wave 4 for whatever reason. Now we're going to actually examine our main variable of interest, so R4TR20, our total word recall summary score. There are a couple ways to look at this variable. We can perform a tabulation or tab to look at the frequency of each score, or we can summarize it to look at a mean and see some very basic descriptive statistics. We're also going to take a look at hearing. Because we expect the self-rated hearing variable in CHARLS to be a categorical variable, we're going to look at it using the tab command. So let's switch back to Stata and take a look. If we type Q here in Stata and enter, we'll first see our tabulation for R4TR20. We see that our scores range from 0 to 20, and most of them are centered around the scores of 3 to 11. Then when we get to our summarize command, we find that there's a mean of 6.76 and a standard deviation of about 3.8. When we look at DA039, we see that we have categories ranging from 1 meaning excellent to 5 meaning poor. And we can see that most people have actually rated their hearing as fair. So we're going to go ahead and create a self-rated hearing variable. We're going to use the generate command and create a new variable called R4 hearing. We're going to set R4 hearing equal to DA039 if the values of DA039 are between 1 and 5. We're also going to create a label for our values called rating, and we're going to assign that value label to our R4 hearing variable. So let's switch back to Stata and take a look at it. So when we continue the program, we can see that we have created this R4 hearing variable and applied the labels, and now we have a tabulation where we can see that everything was done correctly. You can see that I've also saved this analysis dataset in one of the folders I specified at the beginning. Now we're going to apply weights. And one of the helpful things about using Stata is they have a lot of built-in commands for using survey data. One of those commands is called SVY_set, which tells Stata how this complex survey is set up. This allows us to tell Stata how the data is weighted. Here we're using the person-level cross-sectional weight, and we can end up with national-level estimates for people over the age of 45 in China. Once we enter this SVY_set command, we don't have to specify these things for every single analysis command that we make from here. Instead, Stata will recall this information. So let's do this inside of Stata, and you can see that we use this command called svy describe so that we can describe our sample. You can see that we have one strata here representing China with just over 20,000 respondents who participated in Wave 4. So I think before we get into anything more involved, we should first just estimate the mean for total word recall score for the population covered in the Charles sample. That is, people age 45 and over in China. So to recall the SVY set information that we gave Stata about our survey design and how we want our estimates weighted, we're going to say SVY, which tells Stata to recall what it was already told, and then we ask for the mean of R4 TR20. So if we do this inside of Stata, we get a mean of 6.74, which is very close to our unweighted numbers. So, on average, a person who is 45 or older in China will remember about 7 out of 20 possible words between the immediate and delayed word recall tasks. But what if we want to look at the mean by gender and hearing level? Then we can put over R4 hearing RA gender after the mean statement. And we can see the mean for our 5 hearing levels for males and females in a single statement. Let's see what this looks like. So if we run this, you'll see that Stata tells us who is in each subpopulation. We can see the mean total word recall for our 10 gender and hearing level categories. You can also see that we have standard errors and 95% confidence intervals, which can be helpful if you want to know whether these are meaningful differences. But now let's look at mean total word recall by gender and hearing level visually. We can see that males in China score slightly better than females for every hearing category except for very good. But based on the overlapping 95% confidence intervals, it doesn't look like there are statistically significant differences. We can also see a marked decline in total word recall for every drop in hearing level, with the exception of very good and good, where there's not much of a difference, especially for males. And if we want to test whether the differences we see are significant, then we can use a command called test, which is a post-estimation command, meaning you run it after you've created your estimates. So here we've created mean estimates of total word recall score by hearing level and gender. So we'll test whether there's a difference between genders within a single hearing level and whether there's a difference between hearing levels for a single gender. So if we go ahead and run this and test for a difference between subpopulation 1, which is men with excellent hearing, and subpopulation 2, which is women with excellent hearing, Stata will perform an adjusted walled test. We'll see that the probability greater than the F statistic is 0.6168, which is not statistically significant. When we run this with subpopulations 7 and 9, looking at men with fair and poor hearing respectively, we get a probability greater than the F statistic of 0.0000, which is statistically significant. So now it's time to ask a new question, and that is, how does total word recall in China compare to total word recall in the United States? And how does it vary by self-reported hearing level? In order to assess this, we're going to have to append an HRS dataset to our existing CHARLS dataset. To do that, we need to register for the HRS and download the Harmonized HRS and RAND HRS from the HRS on the Institute for Social Research website. The link can be found on the first row of the download page on g2aging.org. The codebooks for these datasets are also available on the ISR website or from the gateway on the third row of the downloads page. Then we're going to identify the relevant variables from the RAND HRS and the Harmonized HRS. After that, we'll pool our observations from CHARLS and HRS to create a single analysis dataset. We'll prepare our variables, apply our weights, and finally analyze total word recall across countries and hearing levels. After downloading the Harmonized HRS and RAND HRS, we'll identify the variables we need. We'll use Wave 12 of HRS, which happens to have taken place in 2014, which is close to the Wave 4 of CHARLS that we're using from 2015. We'll look at the RAND HRS first. The person identifier in HRS is HHIDPN. Total word recall is called R12TR20, and we have the respondent age, which is called R12AgeY_E. We have the respondent's gender, called RA gender, and we'll use the respondent level weight, called R12WT-RESP. From the Harmonized HRS, we'll still be using the same person identifier, and we'll use R12 hearing for self-reported hearing and RAED-UCL, which is our harmonized education level. So we're going to merge variables from the RAND HRS and Harmonized HRS datasets together. To do that, we're going to use the variables we identified from the RAND HRS using the RAND HRS dataset. And we're going to do a one-to-one merge using the ID variable HHIDPN using the Harmonized HRS dataset. Then we're going to specify to keep using only the variables we need. So let's go ahead and check out this merge in Stata. Now in Stata, we continue our program and find that over 37,000 observations have matched and just under 5,000 observations have not. The reason for this is that the RAND HRS has been updated to contain Wave 13, and we have not yet released our update to the Harmonized HRS with Wave 13. The HRS added a new sample in Wave 13, so we have 4,500 individuals who are new to Wave 13 and so not in this version of the Harmonized HRS. And during this update, the RAND HRS also deleted a single observation, which is still in the Harmonized HRS for now. But we're looking at Wave 12 of the HRS and not Wave 13, so we're not going to worry about this too much right now. You can see I've also saved our HRS analysis dataset. So we're going to go ahead and pool our CHARLS and HRS analysis datasets together. We're not going to merge them together because there should be nobody in common between these datasets. Instead, we're going to append them, which will put our HRS observations below the CHARLS observations in Stata memory. So we'll use our CHARLS analysis dataset first, and we're not using a keep using option because we want to use all of the variables in our prepared CHARLS dataset. Then we'll append using our HRS analysis dataset. With this append statement, we're telling Stata to create a new variable called country, which will identify which datasets the observations are coming from. It will automatically assign a 0 to the first dataset, so our CHARLS observations, and a 1 to the second dataset, so our HRS observations. But I'm going to recode that variable so that China will be country 1 and the US will be country 2. We're also going to label our country variable so that we have no confusion about where the data are coming from. We're going to assign a value of 1 to China and a value of 2 to the USA and apply our new value labels to our country variable and take a look. So now in Stata, we continue our program and see our tab for country. We see that we have 25,000 observations from China and 42,000 observations from the United States. The next step we're going to do is prepare our variables. You may have noticed that the variables from the harmonized datasets contain a wave number, and this is particularly helpful if you're only looking inside of one study. But when you want to compare between different studies and you want to compare the same years, you're most likely going to need to create some new variables to make up for the different waves between studies. So we're going to make some new variables based on the year and not on the wave number. Our first variable will be R 2014 TR20. So we know that the values will come from R4 TR20 if it's coming from Charles, marked by country number 1, and from R12 TR20 if it's from HRS, which is country number 2. So we're also going to take the same steps and create R 2014 hearing for self-rated hearing and apply a value label. We'll also create R 2014 age Y for the respondent's age in years and weight 2014 for our person level weights. So once again, we're creating new variables based on our year of analysis rather than the wave number that contains observations from the Charles and HRS datasets. So if we type Q here in Stata, we'll create those variables. Now that we've set those up, we're going to save the dataset and we can move on to our next step. So we're going to apply weights using the SVY set command again, using the combined weight 2014 that we just created. And we can also tell Stata about how the sample is stratified or clustered. So in this case, we're going to say that our strata is at the country level since we're now dealing with multiple countries. This will make our weights refer inside of each strata or each country here, and we can end up with national level estimates for each country. So when we do this inside of Stata, you can see we use the SVY describe command again. You can see we now have two strata here because we have China and the United States. And there's just under 40,000 observations from the 2014-2015 wave for both of these studies. So we're going to estimate our mean total word recall score for China and the US. So we're going to include SVY to recall our earlier command for weighting the data. Then we're going to ask for the mean of R 2014 TR20 over the country variable. So if we do this inside of Stata, we now have two subpopulations. We can see the mean total word recall is about 6.7 in China and about 10.2 in the United States, which seems like a pretty big difference. It's also important to remember that the HRS target population does not include ages 45 to 50, but the Charles target population does include these ages. And if we want to test whether there's a statistically significant difference between countries, then we can use the test command again. So if we run this, using the results for China as subpopulation 1 and the US as subpopulation 2, we get a probability greater than the F statistic of 0.0000, which is significant. Now, if you're interested in limiting your analysis to a subpopulation, then I'll show you how to do that. For this example, we'll look at word recall across hearing levels and countries, but limit it only to men. To do that, we're going to add a comma and subpop after SVY, then set our condition. In this case, if RA gender is equal to 1. If you were to instead put an if statement after the mean statement, as in mean R 2014 TR20 if RA gender equals 1, then the standard errors would not be calculated correctly. Or you could be interested in running a regression and regressing total word recall over hearing while controlling for gender, education, age, and country. To do that, we're going to still use SVY to weight our analysis. Then we're going to use the regress command, and since total word recall score is a continuous variable, we can run a linear regression. R 2014 TR20 is our outcome of interest or dependent variable, so we're going to put that as our first variable. Then we include all of the independent variables. So R 2014 hearing, RA gender, RA EDUCL, R 2014 age Y, and country. The I dot in front of hearing, RA gender, and RA EDUCL create dummy variables for the different value of these categorical variables, using the lowest value as the base. R 2014 age Y is a continuous variable, so it doesn't need a prefix. For country, I can use an I dot, but when you want to assign a certain base for the dummy variables, then you can say B and the value of the category that you want as the base. So by saying B2.country, I'm assigning the US as the base instead of China. So if we go ahead and do this inside of Stata, we can see the results for men in these two countries by hearing level. So Chinese men with excellent hearing have a mean total word recall of about 8.6 in subpopulation 1, while American men with excellent hearing have a mean score of 10.5, which is subpopulation 6. Once again, you could use the test command to determine if there are significant differences between some of these subpopulations, but we're going to go ahead and move on to our regression results. We can see that compared to those with excellent hearing, word recall scores are estimated to be decreased for people of lower self-reported hearing. And this makes sense because if you can't hear the words, you're going to have a hard time remembering them. It looks like being female and having more education are estimated to improve word recall scores, while being of a higher age will lower word recall scores. Then, compared to the US, individuals in China are likely to score almost 2 points lower on word recall tests on average. In case you're interested, I provided a graph showing the mean word recall score over country and hearing level for both genders. You can see that, like China, the US also shows step-down progressions for decreases in hearing ability. But the US appears to have higher levels than China overall, and it looks like women tend to score higher in the US for better hearing levels, while there is little difference in China, or we even see men score better. So that's going to wrap things up. If you have any questions or comments, visit us at g2aging.org or email our help desk at help@g2aging.org. We can help if you have specific questions about a harmonized data set, how to find a variable, or in figuring out how to get started. I'll also mention that the slides, a video recording, and the Stata code from today's webinar will be available on the Gateway to Global Aging website in the next few days in case you want to watch it again or send it to a colleague. I'll go ahead and show you where to find that on the website. You can go to our documentation page, and it will be right here under recent presentations. And if you're looking for an example of an analysis using SAS, I suggest you check out the SAS code listed in the August 2018 Advanced Cross-Sectional webinar. So thank you for joining today's webinar, and we hope that you find the harmonized datasets useful. After the webinar, you'll be sent a short survey where you can provide feedback or tell us about what topics you'd like to see in future webinars. We're always trying to improve our offerings to be relevant to you, so please fill the survey out. I'm now available to take any questions that you might have, which you can do in the chat window or by using the question box. I'll be here for as long as there are questions, but if you're leaving us now, thank you again for attending. Have a wonderful day, and I hope you and your loved ones stay healthy. Once again, I'm open for any questions in the question box or the chat box.
This is Tristan. I'm the other organizer for today's webinar.
I see a question here.
Oh, good.
Okay, so the first question is, do harmonized mean all the data sets have same variable names to use and comparability is easy? So we try to make the harmonized data sets and harmonized variables as comparable as possible, but sometimes there are differences in question wording or cultural norms that make it difficult to make an exactly comparable measure, in which case we will offer a slightly different naming convention for the variable, and we'll also be sure to mention any differences in the text for the codebook. I got a question, is the recording going to be made available after? Yes, as I said before, it will be under the documentation tab of the g2aging.org website under recent presentations within the next few days. Okay, I have another question, where to access data specific to a country. So it depends which country specifically you're talking about. But the links for all of the data sets will be available on the top row of the website under the downloads page. If you have a specific country in mind that you would like to discuss, you could add that to your question. Okay, we have another question about wondering which weight variables to use in CHARLS data. So that would depend on what sort of analysis you're running. If you are doing a cross-sectional analysis like we did today, then the person level cross-sectional weights would be an excellent option. I can't remember specifically, but we'll go ahead and look at the code book here. There are also household analysis weights. So if you're doing a household level variable like income or wealth, then that might be a good weight to use. We have a question specific to the HRS, whether there are geographical identifiers like states available for the HRS, and the answer to that is no, at least not in their public release data. They do go down to census divisions, which is groups of 5 or 6 states roughly, but not as specific as states. Okay, we have another person who says, I want to know about the longitudinal study analysis using LASSI. So for those of you who aren't familiar, LASSI is the longitudinal aging study in India, and it is a very large cohort study that we're actually helping to conduct at the Gateway. So the LASSI has approximately 70,000 respondents, and we are hoping to release data both publicly and with the Harmonized LASSI data set before the end of the year. Until then, I'm sure once it's released, we'll have another webinar teaching people how to use LASSI, but until then, I can't really get more specific. Okay, we have a question. When you use SVY, you didn't include clusters for the HRS. Does it mean that we don't need to take into account the clusters when doing the cross-national studies? It is a best practice to use the clusters when you are conducting these studies. I didn't do it here, but it would be a best practice and it would be great to include in your own analyses. I have a question here about when after we applied weights, why the population of size of China appears to be incorrect. I'm actually not sure what you're referring to in this, but if you don't mind, you can send an email to our help desk at help@g2aging.org, and we'll be sure to look into this additionally. Okay, we have a question about our online registration, our universal study data. And so is that good to get all the data? So right now, if you can use our universal access to study data to register for all of the studies that we produce harmonized data sets for, except for ELSA, which is the English study and requires additional, it requires you to go to the UK Data Service website to register there. They have special rules in place, so we cannot offer that in our universal study data page. But for all of the other studies, you can fill out the information and basically get all of your registrations done at once. So we have a couple more questions about the Indian data. And once again, we're going to be releasing the LASSI data before the end of the year. So if your study can wait until that data is coming out, it would certainly be beneficial because the sample size is much greater than in the pilot study. We have a question about person level weights in SAS when we're running regression type of analysis. I don't use SAS on a super frequent basis. If my coworker knows the answer off the top of his head, he can feel free to go ahead and chime in. Otherwise, we can you can check out the analysis example using SAS on the recent presentations portion of the documentations page on g2aging.org.
I can chime in too, Jenny. For SAS, no, you don't want to make your weight an independent variable.
Today's webinar, the slides, and the data code will all be available under the documentation page under recent presentations in the next few days. Do we have any more questions? Okay, it looks like all of the questions have been asked. Once again, if you have thought about it a little more and come up with a question that you'd like an answer to, you can check out our website, check out our help page, or go to email us at help@g2aging.org. Oh, I got a final question here. We'd be interested in online workshops. Will there be any in the near future, especially using Lassie? So once the Lassie data set is released, we will be offering another webinar, but we can't plan that because we don't know quite exactly when that data will be released. And we'll also be offering additional webinars within the next few months. And in terms of workshops, if that is meant to be more collaborative, I don't believe we have any planned for this year. But should that change, we'll send an email out to everybody who is a user who has accepted the ability to receive emails from the gateway, and we'll be sure to let you know about that. All right, I think that's it. So thank you again for attending. I hope all of you are able to stay healthy and well and find the harmonized data sets helpful.